All right, well, thanks for your patience and my arrival. Obviously, had important work to attend to with funeral services of Private First Class Justin Kirby, which just took place. And before I talk about the latest developments with the coronavirus and in our area, I wanted to say a word about him. He was a great kid. He was 21 years old and had his entire life in front of him. And like his brother, who's an EMT in the city, and like his father, who's a firefighter in the city, he chose to serve. And a lot of folks knew him in the city and respected him as somebody who would serve this country very well. And by all accounts, he was an exemplary soldier and had an entire career in front of him, and tragically he passed, as we all know now, last week. And so I just again really want to reiterate my condolences to his entire family, to the Bedford Fire Department, the New Bedford Emergency Management Services, where his family members again are employed, and to all of his friends and loved ones in the city. I will say this: it's just given the time we're in and the requirements, the very necessary requirements around social distancing. Unfortunately, we weren't able to have the kind of send-off that was becoming of his service and of the type of person that he was. It was as we saw, a very sort of truncated service, very appropriately held, and we would have liked to have had a little more time to celebrate his life. I do want to just really commend how many people, all the folks who came out along the parade route. There were by all accounts, hundreds of people who came out and showed their respects, and that's especially here in the city, and that's something that I'm proud to say. The residents of our city came out in droves to pay their respects, and that's it says a lot about the folks here in New Bedford. It says a lot about the folks in other places in Massachusetts along the route. With respect to the coronavirus developments, as you've learned, there is a presumptive positive case of a New Bedford resident. The case, the test has to go to the CDC for confirmation. That's the process that applies all around the country right now. But a presumptive positive case, the individual is under quarantine right now. There are others in quarantine who may have been in close contact with him as well. These are all appropriate measures. Because of the constraints of HIPAA, we cannot go into his identifying information and who he is and where he lives and so forth. Folks should know that our first responders, as well as South Coast Health, where he was tested, are very well aware of his situation, continue to monitor him as time goes on, and are closely monitoring the situation. People shouldn't be surprised about this development at all, and I think it was important today to release the fact of the presumptive positive test on an individual here in New Bedford, because there is, I think, a risk here that we might think somehow we're not in the midst of it at all, of all of it, and the reality is we are. We may not be as far along in terms of in the progression of the transmission of the disease as places like New York or Seattle or even Boston or Rhode Island, but it's coming, and people should know that. And it's not only coming, it's already here. And so, as test kits become more available, and as I understand it, South Coast Health just got another 500 test kits. We're grateful for that. It's not nearly enough, not even close. There will be more tests, and there will be more positive tests to come. And so really this is an occasion to reemphasize the social distancing that is absolutely necessary. All of you and many others in the city just witnessed this funeral procession and memorial service for Justin, and saw just the level of responsible social distancing that people were doing, as difficult as it was under those circumstances. And I think that's a good example for everybody. So, we have to be vigilant immediately and in the long run. And so what that means, frankly, is all of us need to change habits. I start with me. I heard a call on the radio station earlier this week that said, I saw Mayor Mitchell touch his face after he got off the podium, and okay, I'm busted. I did, but you know what? It requires all of us to really be conscious of what we do with our hands, how far apart we are from people, refraining from just things that come naturally to us, like hugging others, shaking hands. We have to be. We have to be disciplined. I heard earlier today, I had a friend who had a bunch of folks over, had a bunch of kids over from the neighborhood with, I'll just let this pass. The story I was relating was we've heard from folks who've, I think they would have cooperated. Yes. All right. We've heard of stories of people having, lots of kids over the house, and from the neighborhood because kids are bored, and their own kids insist, well, can't I have my friends over? What I tell people is, what I would tell everyone is, no. Just say no. You got to say no to your kids too. As difficult as that is. You have to take these steps, and we're gonna be in this for a while. We're out of school for 2 weeks. I think people should fully anticipate that it's going to be longer than that, and that the social distancing measures are going to be in place for some time. If most of the epidemiologists and infectious disease physicians who've looked at this have said, look, there's a risk of a second wave, right? So what we're doing now is to flatten the first one, of course. That's why we're doing all this stuff. But there's a risk once the fall rolls around, the normal cold and flu season rolls around, that there will be, another uptick. And if we completely backpedal from the measures that we're taking, we're going to be right back where we started. So ultimately, I would just continue to encourage folks to take the necessary precautions, and we can't emphasize it enough: washing your hands and all the social distancing. So with all that, there are other things to emphasize, but I'll open it up for questions. Go ahead, Mike.
Do we have a origin of this person? Is it international, coming back home, Biogen conference? Like, where is this?
No, community spread. So the community spread, people should know that. And again, because of the constraints of HIPAA, that's about as much as I can say. You heard my pronoun, right?
Old?
So
can you tell us how old?
No.
How many people are in contact that are being quarantined with the person?
There are, so it's hard to know exactly how many, but South Coast Health is taking those steps, and you will see, and that's another thing that you're going to see over the next days and weeks. You're going to see more quarantining going on here. We've seen it. As close as Rhode Island. There are a number of folks who are quarantined in Rhode Island. There haven't been many here. There will be a lot more real soon.
Can you tell us if the person was experiencing symptoms?
No, I'm not going to get into his medical details.
Can you tell us how South Coast Health got its 500 new test kits?
Yes, those were distributed by the state, and South Coast got 500 of them, which is a relatively small fraction of the whole. There were many more positive confirmed cases up in the Boston area, especially, but in other parts of Massachusetts. There are more confirmed cases, of course, in Rhode Island as well, and so we may be some time behind them on the curve. It's hard to begin to know like how far behind, but we're on the same curve. And so the test kits are going to those places where where the curve is closer to a peak.
Any new measures that you're instituting now because of this presumptive positive case?
No, look, we've been saying all along that folks should fully anticipate more positive tests, more folks in quarantine. We announced yesterday, of course, measures concerning places like personal convenience businesses, so barbershops and hairdressers and tattoo parlors and massage parlors, tanning salons, all those things, and similar businesses. So that order, my order goes into effect on Monday. So if you drive around the city, you'll see a lot of people getting their hair cut.
Can you at least confirm that the people who have close contact have been notified?
Yeah, there's so what happens, Mike, when these things take place is that there is what's called contact tracing. So, in other words, an investigation is done as to how the patient became infected, and you trace out from there. As you can imagine, once you start getting more positive hits, that becomes a much more difficult and more unwieldy exercise. The more people who come in positive, the harder it is for the system to do all that tracking. And so the more we can do now at a point where we don't have many positive tests yet, the better off we'll be.
Do you know how many tests? Do you know how he's doing? Is he at home quarantining?
Yeah, he's at home quarantine. Yep.
Do you know how many tests have been performed in New Bedford or in the area?
Yes, so South Coast, so I don't know how many have been done in the area because we have multiple providers, Brendan, but South Coast Health at this point has done more than 100 tests, and in their system there have been 2 positive hits. So again, that's good news overall, but we just don't, because of the constraints on testing that were in place up until a few days ago, we just haven't had too many tests done around here. And just as a reminder, you know, the testing criteria, the restrictions are in place to effectively ration the test kits. There aren't that many test kits here in New Bedford, Massachusetts, Rhode Island, New England, everywhere in the United States, and so those test kits have to be conserved to the greatest degree possible. And so early on, now there are more test kits coming out now, but up until just a few days ago, if you hadn't been to China, if you were in close contact with somebody who'd gone to China, and if you hadn't, ticked off a couple of very other narrow blocks, you weren't going to get a test. Now more test kits are coming in. There's more testing done, but not nearly as much as we'd like. So the 500 test kits that South Coast Health just got is good news, but we frankly, just in this area, in our metro area of roughly 250,000, we need thousands of kits.
You said 2, that's Freetown and New Bedford, and that's translates to a 2% result positive on 100 tests, right?
So the person in Freetown, as I understand it, wasn't in the South Coast Health System. The one in Wareham was. So yeah, just to clarify. Yeah.
So Mayor, are you involved in any advocacy efforts to make sure that South Coast Health and our other healthcare providers have the PPEs and the equipment that they need?
Yeah, all the time, and that's another big area of concern. My biggest areas of concern is doing whatever we can to support the health system in our region to be able to absorb the wave of patients that inevitably will come. We want that wave to be as little as possible, and that's why we're doing all the social distancing and other things. But once the patients start coming in, and they are starting, we need to make sure that they have what they need, whether it's other facilities or staffing or whatever we can muster to, so that they can do what they need to do. And then my other big concern is with protective equipment. We're starting to see our emergency responders are very resourceful, and so they are calling their friends everywhere. We're calling places like nursing schools that may have extra masks. We're looking for high and low for masks anywhere in the commercial sector. There's been some indications out there that some masks are maybe reusable if you microwave them for a certain amount of time in a certain way. I can't really speak to that technical detail, but I can tell you that we're doing everything we can to secure more equipment, and we're also talking to, I've had many conversations with the governor and lieutenant governor about the needs of personal protective equipment. They're very well aware of it, and we can't make the stuff fast enough. I know some of the factories in the region have been approached to retool to start producing personal protective equipment. I don't want to go into names and stuff because that just just a second. So we just want to make sure. So whatever, if we can support those efforts, we certainly will. I am concerned with ICU capacity. Everybody is around the country. There aren't enough ventilators out there for sure. I mean, you can find more room. There are two big capacity constraints. It's not so much facilities per se, right? You can find new places to retrofit to be, to serve as temporary hospitals. The two big constraints are staffing, right? So making sure that staff doesn't get infected is a big priority everywhere across America. And then secondly, having equipment like ventilators ready at hand. And that's why, all of the big three auto manufacturers have all been approached about, pardon the pun, switching gears and starting to manufacture ventilators because they're going to be in short supply if the surge is as large as it conceivably could be.
Does this pandemic change your mind on closing the fire department?
It has nothing to do with it. No. So the fire department's primary mission is to put out fires. They go to emergency medical calls, but not non-emergency medical calls. So no, I don't think that they're related.
Can you talk the cycle? So by the time you announce that he's been positive, how long does it take from St. Luke's to get to the state and they say it's been positive? Is it like a 24-hour period? Is it a longer period?
It's the turnaround is, as I understand it, a matter of days. I think that's starting to speed up, Mike, because they're starting to get into starting to do it a little more systematically. The CDC confirmation takes a little bit longer. I can't say how long that is.
By the time you announced that he's been positive, he took it 2 days ago, probably.
So we, as I try to I think it is about 2 days. It's a matter of days, whether it's 2 or 3. I'm not sure. I think that's starting to get faster. I don't know precisely how long it took. We just got word of it this morning, though.
Is there anywhere in the public this person was known to frequent?
Yeah, I don't like. Yeah, people. So honestly, this is the first of many positive cases to come, and many people who will be quarantined, and so we should just be aware of that. And so, as we frequent places, as we visit places, be mindful of your surroundings, other people in particular, highly touched surfaces, where your hands are going, all that. And one of the things I do want to say is we've seen really good compliance with respect to social distancing at restaurants. People are doing takeout. That's all to the good. We encourage that. But, as we look at grocery stores, and we have many grocery stores in the city, there are many around Greater New Bedford, we've seen some big crowds in part because people think that they've got to stock up, for the apocalypse. That's not necessary. There's been no interruptions to my knowledge, none that no reports I'm aware of any material interruptions in the food supply chain in this country. So people shouldn't feel the need to go out and buy 2 years worth of tomato soup at their local grocery store. It's not going to do you any good. It's just going to crowd the grocery store and make it harder for people to keep their distance among one another in those places.
Last question, guys.
The latest number is, I believe, 8 in Bristol County as of today. Is this individual included in that 8?
Yeah, I believe so, Brendan, but I'm not sure. So I think if you go on the DPH website, you could be able to confirm that. Yeah. Okay. All right. Thanks, Guy. I appreciate your patience today, and thanks for getting the word out. It's. I mean, I've said this before. The role you're playing is really invaluable here in pushing as much information out to the public as possible, and we'll continue to do that on our end. All right. Thank you.
Thank you, Mayor.
Thanks.